Incredibly difficult for so many, especially for those working in the healthcare profession. Burnout among lab professionals is now on the rise as more people consider leaving their jobs. For more on this, we're joined live this hour by Michelle Hoad. She is the Chief Executive Officer for the Medical Laboratory Professionals Association of Ontario. Michelle, thank you again for making time today.
Good morning.
So let's start with the latest research out of the University of Toronto and Guelph about burnout. What do we know about this?
Well, the research was actually done over the last 2 years. So they've just shared with us that the number that they had seen was about 73% of our profession is feeling burned out. To follow up with that, we just did another survey 2 months ago. That number has now reached 90%. So we've got a group of people right now working that just can't sustain this pace much longer.
And talk about why we're seeing this burnout. How are people in the field feeling about this?
Very exhausted. I spoke to just a technologist yesterday. What they're telling us is that they are having to work what they call mandatory overtime. There is a requirement of minimum number of staff in our labs, but we don't have enough to currently staff. So if somebody calls in sick, the person that has worked that night shift may need to stay and work the day shift. They don't have the option to leave. So that's some of the stories we're starting to hear. It's alarming. They're telling us now that they want to leave the profession. It's not a good situation in our labs.
Yeah, I want to ask more about that. How is all this burnout impacting retention?
Really, really difficult. So 73% have said they actually wish to leave the profession. Means if they could, they would. 42% of that number are actually people eligible for early retirement. So we are right now in a situation where, when we look at the announcements made over the last 2 weeks, which have been tremendous investments in healthcare. Every day we hear about investment in a hospital, investment in helping nurses, investment in helping physicians. We seem to be missing the message around what about the lab? Nothing can happen in healthcare unless we have a fully staffed lab. So it doesn't matter how many beds you add, how many hospitals you add, you need investment in those people so they can actually provide results so doctors can do their jobs.
So Michelle, explain to us what sort of solutions you think might work. We're a month away from a provincial election. What do you want to see from the next government? And have any of the candidates so far presented solutions that make sense to you?
So we have actually been in discussion with government for a period of 8 months now. What we need to see definitely with the next government is immediately a retention plan to keep the people we have. So, for example, 2 months ago, there was an announcement of $5,000 retention bonuses for nurses. That is an automatic that should happen for lab. We need to keep these people. Secondly, we are in big trouble in our northern communities. We have lots of people that are struggling up there. We need investment specifically up north. So hopefully we'll have those discussions. The good news is we have a meeting Monday morning with the Ministry of Health to bring them up to speed on this. So we'll see where the next steps take us.
And Michelle, we're in the middle of this sixth wave. Testing here in the province has been expanded. So we know that lab workers are going to be even more busy in the next couple of weeks. Can you talk a bit about what will happen if we don't see some of those solutions implemented soon?
So we will start to see a delay in turnaround times. So what that means is if, for example, you're going in to get some regular testing done and you find out within 24 hours, that may take 48 hours, that may take a longer period of time, which we don't want to see because that affects our health, it affects results, it affects how doctors treat patients. So the worst case scenario is we get to a point where we actually can't be providing results. We don't want to do that.
Okay, really important conversation. Michelle Hoad, thanks so much for your time this morning. We appreciate this.
Have a good day.
You as well.